Rev-Up office numbers are 572-0383 and 572-0215. Rev-Up St. Lucia, the alpha of radio.
Doctor in the House brought to you the compliments of Laasalis, Ultramat, the Labry Credit Union, and Tapio Hospital.
At Tapio Hospital, caring and competent obstetric consultants who will see you safely from prenatal care through delivery with a team of excellent pediatric and anesthetic support. Tapio Hospital, where the patient safety comes first.
At Labry Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time, a time when your plans and dreams fall into place, when what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Labry Credit Union. We're not a bank. We're better.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramat. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today, or check us out on our Facebook and Instagram page. Ultramat, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramat.
It's delicious.
Laasalis is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? Laasalis, of course. Laasalis, Castries, Rosalie, Beaufort, and Soufrière.
It's delicious.
It's now time for Doctor in the House, hosted by Dr. Leonard Suraj. Dr. Suraj, a very good evening to you.
Thank you very much. This one sounds especially good. It's good evening. Good evening, listeners. Good evening, followers of this program. You are listening to Doctor in the House, and today, 12th of August, we have in this program live, streaming live on various platforms, etc., YouTube and X
and Facebook,
etc. So, yeah, and every Tuesday we are here discussing some aspect of medical stuff, and sometimes it may not be medical, but social and impacting on medical care of some sort. I have with me in studio not a newcomer to the program. She was there a few weeks ago, and we had unfinished business. So I didn't have to persuade her very much to come to do the show again, because there were many issues that we had not actually covered in dentistry. Now, Dr. Simon Liverpool is a specialist pediatric dentist. Now, just like medicine, just a point of clarification. Like medicine, dentistry have subspecialties. So you learn basic dentistry after you do your A-level and the usual stuff. You go to university, you learn dentistry. I think it's a 3-year program.
Well, no, dentistry is normally 4 to 5 years.
4 to 5 years.
And then after, if you want to specialize, there's either a 2-3 year program or
right.
even
So after you
more.
become a dentist, you go back to study and be a specialist in a variety of areas. And Dr. Liverpool is a specialist in children dentistry, pediatric dentistry. You may wonder why all these things are going to fall off anyway, why you need a dentist for that. but she will tell you the full story of how important that is, because from our little discussion before the program started, we estimate that in excess of 90% of the problems children have with their teeth are preventable, and poor education is the main reason. So I have with me in studio Dr. Liverpool. Welcome again, Dr. Liverpool.
Thank you so much for having me back. I quite enjoyed the last program.
Yeah, and I think the listeners did actually benefit because some of them called, etc.
Yes.
Yeah. So, what do you see as the main reason why children's teeth are going bad?
The first thing that would pop into my head would be lack of education on the part of the parents or the carers, and from very early on. So parents, young mothers, fathers, family members need to know that as soon as a child starts to develop teeth, definitely by their first birthday or whenever before then that they do develop teeth, it needs to be cleaned like any other teeth that they would have in the future. Even 2 little teeth, you still need a age-appropriate tiny toothbrush with, at that stage, the earliest stage is a fluoride-free toothpaste, and get the baby at that stage into the habit of brushing twice a day. I would even go even a little further back, that even before a child starts to teeth, it is always recommended to clean out their mouths after feeding or after eating without teeth.
Okay.
All right, so normally at bath time, with a clean rag and water, it's encouraged, just to clean out the child's mouth. So from a young age, they start getting into the habit of, somebody playing around in my mouth. Yeah. Because what I have seen over the years, and mostly working in the outer districts, is I've heard people say they only start cleaning a child's teeth, or aka brushing it, on a daily basis, like when the child is 2 years old. By the time most children are 2, they would have most of their primary teeth present. So oral hygiene, the knowledge that the parents or caregivers should have from inception is what's very important. And if that could be passed on, all this tooth decay is preventable.
But you'd appreciate also that a lot of parents themselves, when you look at some of the adults' teeth, you realize that they don't really take care of their teeth. So that knowledge maybe need to be passed on as soon as they are going to become parents.
Definitely. I totally agree with that. So with the antenatal or prenatal care that I know that they do get at the health centers, hospitals, and even in private offices, it's very, very important that this initial behavior dentally becomes a part of the routine. As well as I think also the medical doctors also need to be passing on these basic habits to mothers or parents generally.
But how can a doctor do that when a typical visit, 5 minutes, basically? The typical doctor doesn't have time to counsel you when it comes to those kinds of things. So how is that knowledge supposed to be passed on to the parents? I remember as a young boy, the only time we got any information about dental care was at primary school, and you heard the thing about brushing twice a day, and that was about it, right? We didn't know things
that
like...
That still applies.
Yes, I don't say no, but I didn't know, for example, that if I brush my teeth, the type of bristles mattered.
Yes. Very much so.
How hard I brushed mattered. I didn't know those things. In fact, recently, I saw my dentist, and she was telling me that after I brush, just spit out the toothpaste
and not rinse it out.
Yeah, exactly.
And studies have shown that decreases decay by about 30%.
Really?
Just having that.
Dr. Suraj didn't know.
The leftover toothpaste in the
Welcome
mouth.
to the club, Dr. Suraj.
With the fluoride, it shows that because fluoride works topically.
Yeah.
So we don't do, what do you call it? a long time ago, they would have fluoride tablets that they would give children to ingest. And over years, they started noticing that the kids ingesting these fluoride tablets, as they got into their adult dentition, there was a lot of staining, like a patchy white staining, which is known as, differential diagnosis, which is known as fluorosis, which is caused by too much fluoride in the bloodstream. It gets attracted to the enamel while it's developing in the bone, leading to this patchy white discoloration of the teeth. So then with studies, they realized that topical fluoride is even more effective with less harm
than systemic.
Than the systemic fluoride.
By topical, just for clarification, topical means applying it on the surface and it works on the surface of the skin. And systemic means you take it in the mouth, it goes in the stomach, it goes in the blood, and it goes everywhere. Systemic.
Into the system.
Right.
So topical fluoride, so one, for the mere fact that, we're spitting it out, we're not ingesting it anymore, has decreased fluorosis. I mean, we do see it in different variations, because it could be from mild to quite severe. So we would see it more in the mild stages, because some children will ingest the toothpaste.
Okay.
But generally, so with that little bit of, I don't know, quas of toothpaste in the mouth that stays in the mouth, that's what helps you. And that's the one that I recommend at nights before the kids go to bed, to do spitting and no rinsing. So you're going to spit out. Now, a lot of parents have asked, but ew, isn't that nasty? They'll be swallowing all the things in their mouth. But these are the things, they have in their mouths or had in their mouth all the time before they brushed.
And you swallow thousands of times a day.
Exactly, but somehow when they think about it, like, ooh, that sounds nasty. So I said, in that case, have the child, depending on the age, just shake some water or rinse out before the brushing. Then you have them brush, or you do the brushing, depending on the age and stage. And then, let them stick out their tongue, and then just, wipe the outside of the mouth, let them spit, and that's it.
So just going back to my question, how do you get that knowledge? Is that something that, okay, let me ask you, was that knowledge always widely available? Because as I said, as a young boy, I don't remember that information.
Fluoride in toothpaste has always been widely available.
No, I'm talking about the knowledge, right? That those things are beneficial to good oral health.
It has been, but it's not maybe been down to the level of understanding on a one-to-one. It's like we know things abstractly. We know we should brush twice a day, but do we really brush twice a day?
No, we don't.
We know we should floss every day. Well, technically we should floss every day, but do we really? So we know things, and a lot of things we don't put into practice. But to answer your question, how does it get down to the people, is just education. We can start in the schools. Actually, I love when I go to preschools, because those are the kids, younger than 5-6 years old. And I tell them, remind mommy and daddy to brush your teeth. Tell mommy and daddy to do it for you before you go to bed. And these kids at that age could be very naggy. Oh, the dentist said this and the dentist said that.
Yeah.
So those are the kids that you need to target, and just maintain that educationally. So as they become older, they implement those same practices for their own children. I mean, to me, that's the only way to go.
Yeah. Now, interesting you mentioned going to the preschools. Is it part of your routine, or it is something that is organized at governmental level, or it is just
That's a good question. That's a very good question.
Governmental, I cannot speak for the government. I did work for the government years ago, and there was a program, and I suspect there might still be one, where there's a dental unit that goes to certain schools, I think mainly primary schools, and they would see all the kids in that school.
Okay.
As to, what they do procedure-wise, I'm not sure. I don't know. I know that was a program. I'm not sure about that, if that's ongoing. But I know that was a thing. From a private perspective, most private dentists, I don't think it's a routine. They go, I guess, if they're invited. or if they want to go, or you know. But it is not. There's no standard operating procedure per se.
Exactly.
Yeah.
Exactly.
And this actually fits into our concern. And the first statement I made was about 90+% of the problem we have with the teeth is because they are preventable and is lack of knowledge. And so, rather than, as you earlier mentioned, rather than knowing fully well that prevention is far better than cure, we should really be more at the prevention side of things, and education is the best form of prevention. So we are back full circle, and I think that, and the reason I asked my question was I just wanted to know what structure in place, and you put it quite rightly, what are the SOPs for that, because I think educating people is extremely important. You will get some feedback, you will get some pushback, you will get varying views, especially there is some controversy regarding fluoridation of water, and some countries are planning to reduce it, but I think that would be an error.
It would be very unfortunate because the science does show that since the implementation of at least fluoride toothpaste in the 1960s or 70s, the amount of decay worldwide has decreased. So there's scientific evidence to back all of that. So, I mean, like I said on the last show, there are countries where the water can be fluoridated, where they add it in, you know, when everything is nicely in a big system. But us that live in the smaller Caribbean regions, where our catchments are very different, it's very difficult to standardize, the treatment across the system. So for us to get fluoride more into our diet per se, probably the best thing would have been fluoridated salt, which is systemic, but at smaller amounts, but still has that protective element to it.
Just like they put the iodine in the salt.
Exactly, same thing.
Interesting enough, and I may have said it, I don't know if I said it in the last program, that fluorine, which is the fluoridation of the water, the fluoride has an affinity or likeness for the teeth enamel. So when it's exposed to it, it bonds to the teeth and hardens the enamel and make it difficult for bacteria to get in.
And as a result, not to cut you, Dr. Siraj, the first stage of dental decay is called this white spots. Again, a very egg shade, opaque spotting on the teeth. And this is the first stage of dental decay. It is also the only stage of dental decay that can be reversed. Okay, and in that same process that you were explaining about the fluoride, that process itself is what can put back the fluoride molecules into the tooth enamel to harden it again. But you have to catch it at that stage, because as soon as that white layer cracks, you get a brown yellowy layer below it, and that now you already have a cavity because that's the dentine exposed. Yes, so fluoride is important. It's just how much we take in. And in St. Lucia, the only place that we have really that we're exposed to fluoride is in the toothpaste. So something called, like I said, the spitting and no rinsing, and it shows that it reduces decay by 30%. That, everything to gain, nothing to lose.
The point I was making is that I only learned this at my age right now. Okay? The ignorance was on another level. Let me give another couple examples. I didn't know anything about filling a tooth. I knew nothing about that. I remember I went to the dentist, and when I went to the dentist, because I had a cavity, and he said to me, if you had only come sooner, I could have filled that for you. Right? I didn't know about that. I didn't know about flossing until I left St. Lucia in my mid-20s, somewhere around there. And then a cousin of mine was telling me about flossing. That's when I got to know about that. I knew nothing about those things. So, and what I find is that the level of ignorance about those things, it is still high.
Yeah, because even I'm seeing now, certainly long ago, living in St. Lucia, you hardly see the floss. Now, it used to be in a long string.
They still have it, but what's more popular are the flossers or flossing sticks.
But there was a time you're not even getting that because I had to buy it overseas. And now I'm seeing most of the pharmacies.
They exactly have floss. Once upon a time, to me, that didn't exist.
It didn't. It was not there.
Because there was no market for it, so why bring it in? Because the people didn't know about it.
The knowledge.
Exactly.
So the knowledge has its own trends, you know.
But like I said, it has to start early. And why I think speaking to young mothers or young parents is because they're interested in that. They're at that stage where they're absorbing, mostly first-time parents, everything.
Yeah.
You know, they watch all the videos, they have the nice books, they're trying to be as good as they can, the best parent. So these little things, if you feed it to them, I think that's where you will definitely get some kind of
traction in there.
Yes.
Yeah.
Because, and I'm seeing it over time, as you say, I'm getting more younger parents coming, saying, "Oh, I saw on YouTube," or we do have some of our pediatric doctors that are beginning to refer more and more children to the dentist at an earlier age. Because, like I said, in my line of work, prevention is better than cure.
And much cheaper than cure too.
Oh, without a doubt, it could be free.
The dentistry,
exactly.
Medicine generally is expensive, and so is dentistry. And a large percentage of the service that's available are in the private sector.
You know, I have friends, and we talk, and my friends will say something like, "I've always wanted to fill some tooth that they lost how many years ago, right, through ignorance." And when now they probably would like to do it. They're in a position now because they're employed and they want to do it. And when they go to the dentist now and they hear what it costs, right? So we go back to the ignorance again, because if maybe we had known those things, we could have, as we said, prevention is better than cure.
Yeah. Because
so now it's very expensive.
Even the adults have a mindset. The tooth giving me trouble, pull it out.
Yes, that's another one again.
Yeah, take it out, take it out.
But we do see a lot of that still. And I tell people now that's old-fashioned. You know, just coming to the dentist actually when your tooth hurts, that's old-fashioned.
That's right.
We should all see a dentist, like I like to put it, man, woman, and child, twice a year, every year.
Every 6 months.
Every 6 months. There are a lot of things that we can prevent, you know, just by just going and checking.
Yeah. So I, in my practice, ENT, have always been telling people, don't remove your tooth. Let the dentist decide on whether you should remove it or not. Because that tooth can be fixed. Even though there's a cavity, they can put a crown on it. There are so many things they can do. Because once you remove a tooth, the remaining adjacent teeth begin to migrate. They begin to change position. And as
interesting word, migrate.
Well, actually, yeah, they
no,
migrate.
they do migrate actually.
It's called migration.
It actually moves.
The teeth don't pull out itself and go and reside somewhere else. The tooth begin to change alignment. So the missing tooth in the middle, the other two begin to close up on it.
Mostly the ones from the back. And if a tooth is missing at the bottom, the one above it has a tendency to over-erupt, as we call it.
Explain that, please.
Over-eruption is, imagine all of your teeth are in your mouth holding each other in place. It's like a brick wall. You take away one brick, you now get a point of weakness, right? And so what happens, the tooth that's above it is not there anymore. So this one on the top, because nothing is there to hold it in place, this one in the top just starts growing. So the ligaments start to stretch and everything because there's nothing to hold it in place. So that's what we call over-eruption. So then you might look in somebody's mouth and you almost see like a tooth that's touching the bottom.
Right.
Okay, that's just because it's come all the way down, and then that now can lead to sensitivities, and then you end up losing another tooth.
You know, Dr. Liverpool, I went through that. I had a wisdom tooth at the bottom, which was very sensitive. Okay, so the dentist said to me, well, suggested I have it removed.
Oh, that one we always
okay.
just remove.
And exactly what you said. She said to me, I would have to come back to remove the top because as you explained there, if I don't remove it, then you'll have that situation where
Over eruption.
yeah, over.
Yeah, so
Yeah.
everything is there for a reason, and for the particular time as well is important.
But since we're on that story, what I see very often, not in pediatrics, but in adult teeth, that they come with an ear pain. My ear is hurting me. Looking at the ear and looking at both ears, there is nothing to suggest there's a disease in the ear or any reason why that ear should hurt. But remember also from childhood, from the time that baby is developing in the mother's womb, the teeth, the nerve for the teeth is shared with the ear. As a matter of fact, the ear has several branches of that nerve. One goes to the ear, one goes to the teeth, one goes to the joint, that joint, your jaw joint, and one goes to the tonsil. So any of these organs that you interfere with, you'll get an ear pain. And the pain has nothing to do with the ear. Ear is clean.
And now we also see the opposite. You can have probably an ear issue or a sinus infection, and a patient comes and they're dealing with a toothache for days and they want the tooth extracted now because they can't sleep. You take x-rays, you look at it, you stand up on your head, you take more x-rays, and you can't see any pathology to cause that kind of pain. And then you're like, okay, let me give you some antibiotics. Call me if it goes away or if it gets worse. And you never hear from them again. And that's because generally the antibiotics will clear up the other infection. So like he said, from the tooth to the ear, and we can also get it from the ear to the teeth.
There's a friend of mine who told me she went for a cleaning recently, and she said that 3 of her teeth just fell off. So what's going on there?
It just fell off.
Well, I mean, obviously they were loose.
They're loose or something.
Yeah.
Oh, well, in a case like that, well, teeth don't just fall out because we have a support structure that the teeth are supported by bones and the gums and all that stuff. There's a periodontal. So for a tooth to just fall out, which means there's no periodontal, no support structure. Now, how does this happen? And it's very common, which is more periodontal disease, where the bacteria attacks the support structure of the teeth. So the bone goes, the gums around the bone eventually start to go because there's no support by the bone, so everything starts to recede. So then you start having a tooth that starts to look longer, but it also starts to shake. So imagine if, I like to give this example to my patients when I'm giving
Talks and things.
No, I talk like this all day long. when I'm speaking to a patient and I want to explain something, I'm very. So imagine that the periodontum, the support structure, is up to here, right? So this is in your bone. This is in the
bone,
mouth, right? So what are we seeing here
Is that part
is
of
the
the-
crown,
Yeah.
the part you see in the mouth, and everything else here is the roots and everything anchoring the tooth in the bone. When you have periodontal disease, you have bacteria attacking the support structure. So the bacteria eats and eats and eats and eats, and the support structure is getting weaker and shorter. So then eventually the tooth starts to do this. Now after a cleaning, depending on how long the person had a cleaning, surprisingly you can have, depending on their oral hygiene, and I've seen it, where there's so much calculus buildup that the calculus holds the teeth together. So that by the time you remove that hard buildup, there is no support, and there are many times over the years that I'm sure a lot of dentists have extracted a healthy tooth, but patients would come and say, I want that tooth extracted. The tooth itself is fine, but they can't eat because it's just,
So you said what's going on? There's bacteria attacking
the periodontum, the support structure of the teeth.
So is that because, again, poor oral hygiene?
Poor oral hygiene.
So that would mean what would that look like? Not brushing the teeth regularly?
Yeah, or not brushing, not even the whole mouth. There's certain areas that people miss. It's not, yes, you do have people that, just forget to brush or don't brush. But it's just sometimes the habit of, we brush so quickly.
Yes.
So absent-mindedly, so not present,
But we're just doing that to finish quickly.
Yeah, so exactly. So most of the time, we're in a hurry.
Yeah.
It is almost like it's a habit you have, and then you want to fulfill that habit.
And you do it unconsciously.
Yeah, and you
it's like driving, it's like
right.
when you reach there, it's like, oh, I'm here already. So you do it so unconsciously.
Right.
So with that bad habit, sometimes you miss areas.
Mm-hmm.
And then you do that over and over and every day, and then you get the, build up, and the bacteria is there. And so sometimes not for everybody, but you can have certain areas, mostly in the back, that you would see it.
Wow. Alrighty.
But the gum disease is something that perhaps a little more explanation should be given, because the teeth can have a decay of the tooth itself, and you have a hole in the tooth. That hole can get deep and cause problem to the nerve.
That's one way.
Or you can have, as Doc was saying, that the cement that hold the tooth in the bone is beginning to erode through bacteria. And so that's why you have gum disease. And you can see people with that, because around the gum does not look very healthy. There's a little red area around it.
Well, it starts off as red or inflamed. You could have a lot of pus and odor.
We'll have to take a little break. Please keep that thought. This is Doctor in the House live on Rev-Up St. Lucia with Dr. Leonard Suraj. The program brought to you with the compliments of Laasalis, Ultramat, the Labry Credit Union, and Tapio Hospital.
Tapio Hospital Radiology Department offers 24-hour service. We provide you with X-ray, CT scans, and ultrasound imaging using the most modern equipment that produces the best images for your medical attention. Call the Radiology Unit at 459-2201. Tapio Hospital, where the patient safety comes first.
At Labry Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time. A time when your plans and dreams fall into place. When what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Labry Cooperative Credit Union. We're not a bank. We're better.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramat. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today, or check us out on our Facebook and Instagram page. Ultramat, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramat.
It's delicious.
Laasalis is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? Laasalis, of course. Laasalis, Castries, Rosalie, Beaufort, and Soufrière.
It's delicious.
This is Doctor in the House live on Rev-Up St. Lucia. Host of the program, Dr. Leonard Suraj. Dr. Suraj, welcome back.
Thank you again. Today we are talking. I have a well-known dental specialist. She's specialized in pediatric dentistry. She was here before a few weeks ago, and we are discussing. We end up having to discuss pediatric dentistry and prevention and education seem to be the way to move forward in terms of reducing the amount of problem we have with dental issues in children and so forth. So I have with me Dr. Simone Liverpool. She's a specialized dentist, specialist in children dentistry. And if you would like to make a contribution to that program, then you can call at our WhatsApp at 287-0971, or you can give us a call on the fixed line 572-9710. If you want to make a contribution, or you want to add something to the discussion so far. Well, Dr. Liverpool, let's continue.
And if you don't mind, Dr. Suraj, sorry to disturb you. Let's take it up from where you said about the teeth beginning to migrate.
Oh, the teeth migrating.
Yes.
Right.
Well, you see, the teeth are in your mouth. One, they have neighbors, one is next to the other. If for some reason one tooth has to be extracted to remove, it leaves a gap, of course. It leaves a space between the teeth.
Mm-hmm.
And that space do not remain like two pillars in a house.
Mm-hmm.
It doesn't remain fixed. It begins to shift. And when it shifts, the teeth above is no longer meeting it as it's supposed to meet the tooth, for you get proper, so that you can get proper what we call occlusion. Occlusion means the closure of the space between the teeth. As the teeth develop, they develop their own way of top and bottom meeting and aligning themselves, and they have this relationship where top and bottom is meeting. Then one tooth is removed. The top, or whichever one is removed, does not have a partner below, and therefore there is a gap. With the tooth migrating or changing, you don't like the word migrate, but that's a word.
That's all right.
With migration of the tooth, it means the up and bottom is no longer meeting in synchrony,
Mm-hmm.
and you get what you call a malocclusion. The malocclusion now, where the teeth are not meeting, put a strain on the joint, because remember, you have one bone called the mandible, the jawbone, that has two joints. And so if one side if one set of teeth is touching each other before the other, there will be a strain on the joint.
So Dr. Liverpool, at that point, what's happening in the mouth now? What does the situation look like when you have that kind of situation?
Okay, so
and what are there any options now available to people who are, like myself, ignorant about those things, and what can be done?
Well, following on from what Dr. Suraj's example is, when you have that malocclusion, where your teeth are not meeting their partner at the bottom or at the sides, then you have the malocclusion. That malocclusion can be corrected if you go to an orthodontist and you start doing braces, because that way they now move everything back into position, or into position in certain cases. So that would be one way of intervening to, prevent something like that.
Mm-hmm.
They have a very cute test that they do. I find this very amazing. It's just like they would give you what looks like a piece of carbon paper and make you bite on it, so that you can see all the impression of all the teeth that are touching.
And where they're touching.
Where they are, and where they are touching.
So it's like carbon paper. So it marks, the top teeth are going to mark, and the bottom teeth are going to mark.
So would the braces be, prescribed for people who are in their old age?
They can be, yes.
Oh, okay. I
Yes, they
thought
can
braces
be.
were like for
I
the
don't
young,
think there's
predominantly
an
young
age
people.
limit per se. I mean, there's certain things that the orthodontist will have to look at, because that's their field. But adults definitely can wear braces. I don't think there's a end age.
But I've seen adults, I've seen people who've been to university, return, and decide to realign their teeth.
Or even way beyond university.
Yeah.
Senior citizens. Let's go.
You have a call, by the way. Yes. The headphones. This is Doctor in the House, live on Rev-Up St. Lucia, and your host is Dr. Leonard Suraj. We have a call.
Hello. Good evening.
Good evening, Andre.
Good evening.
Good evening, sir.
Good evening. Good evening, Dr. Suraj. Good evening, Dr. Liverpool.
Good evening, sir.
Let's hear you.
Thanks for accepting my call.
Okay.
My dear.
Welcome.
Okay, Dr. Liverpool, the last time you were there, you told me, you said a child is supposed to have 20 teeth. By what age?
Generally by age 3. That's when they should have their full complement of primary teeth.
And then an adult, you can say, supposed to have 32 teeth.
Yeah, if they have all of them, yes.
Okay, so between the age of 5 and an adult, I mean, let me ask the question. By what age an adult supposed to have the 32 teeth in the mouth?
Anywhere from age 20 and up. By the time they're adult, their wisdom teeth come through. It could be from 17 and up, or even before, depending. But when they get the 4 wisdom teeth, then it would be the full complement.
Because this person, between the age of 5 and 20, I mean, what happened in the mouth there? Because you're supposed to have 20, then another 32. That's about
so when
12
you get
teeth.
so the thing is, at about the age of 4.5, 5, definitely 6. Behind the last set of baby molars or primary molars, the last set of teeth, an adult tooth is just gonna pop through the gum. That's also about the same time the child is gonna lose the first lower anterior teeth, the first baby teeth in the front.
Yeah.
Okay, so about that time that the child changes those front teeth, there's an adult tooth that will pop up. There's no baby one before it. It just come out the gum.
In the back.
In the back. So that's four extra teeth.
Okay.
So I mean the jaw is getting a little longer, wider.
But of course,
to make space.
remember, a child of 5 has a small face. As the child grows, the face grows, their whole body grows. Okay? So their bones are growing. So at age 3, when they have the 20 teeth, as they reach the age 5, 6 years old, they'll be older. Their jaw, their mandible will be also older, or bigger or wider. All of the above.
And longer?
Yeah.
And longer.
And longer, yeah.
So it will be able to accommodate those adult teeth at the back. Then again, at about age 12, and the second set of molars come up. And then, so that's 4 more teeth.
Okay.
And then from age 16, 17 upwards till maybe about age 25, then you will get 4 more teeth, which are your wisdom teeth.
Okay, so a lot of things happen inside there. Okay.
Yes, a lot is happening constantly.
Okay.
But what is interesting
Thank you.
also... Okay.
Yeah.
Well, thanks for
Good night.
calling. Yeah.
Thank you.
What's also interesting is that the last set of teeth, which are almost growing into, is needing some more space, and that's why many a time you find that the third molar is impacting.
Yes. Impacting meaning that it has no space or no place to come out.
There's more teeth than space.
so to speak. There's not enough room for it to come out. Also, the third lower molars have a whole mind of their own. So it's generally, teeth that are, we would, those are ones we'll definitely say, just extract them. They're not as useful as they were back in the day.
Yeah, because that part of the bone, because sometimes it actually begin to lean and begin to impact on the tooth in front of it. And as if it cannot pass that. So, and infection can be caused between the last two. And therefore, it poses more problem than solution. Okay, you don't need it. You have enough to chew on. You don't need that last
set of teeth.
Yeah, set of teeth. So that is why they would tell you the third molar is giving trouble and they may have to remove it, etc. I had mine removed when I was at university, and it's not pleasant because, again, and that's one thing I wanted to touch on, that putting people to sleep when you're doing these procedures. I find that dentistry has evolved a lot, and I still find many cases which, in my opinion, should be done on the being put to sleep. They are being done and the patient is awake. And many a times when I speak to patient, why is your tooth looking so rotten in there? They'll say, Doc, I know it's there, but I'm scared of the dentist. I just scared of pulling at the tooth. And so there is this fear of pain. And he said, sometimes the dentists are working on your teeth. You can taste the blood. They're talking to you, and they suck it out, and then you hear him. You hear the machine going, wee.
Yeah,
and then
that's
you can
true.
take-
That's true.
And say, Doc, I'm just scared of that. So,
That's
I'm
true.
saying that there is an area where we can improve.
Where we can
That's
improve.
true.
But as a pediatric dentist, and I think besides maxillofacial, that I'm the dentist that have or can have privileges, because privileges I mean by putting the children to sleep in a hospital setting. Because as a pediatric dentist, I'm trained to deal with very young children and children with special needs or adults with special needs. So these are normally an age group or a stage where they're unable to do effectively treatment on a dental chair. So then we can look at putting them to sleep under general anesthesia, where we do everything. We render them dentally fit. So when they wake up, it's just maintenance after that.
You have a call.
Hello.
Hello, good evening.
Hi, good evening.
Good evening, Andrew, and good evening, doctors in the house.
Good
Thank you,
evening.
Good evening. Well put. I must say.
I don't have a question today, but I always learn something from the programs. And one of the things that I learned last time that Dr. Liverpool was there is not rinsing after brushing.
That's right.
Yes. So have you been
I remember
practicing
her
it?
saying that. Yes, I have. I even practice it on my son as well.
Yes, because it is recommended for children as well.
Okay, thank you very much.
That's very
Thank you.
very nice.
Thank
Good
you.
to know that, you see. So
Okay.
it's working, education.
Yeah,
Well
continue
done.
listening. Yeah.
Well done, ma'am.
And I think the other part you mentioned sometime is the early brushing, the habit. The child is raised with a habit that they know they have to do it, and there'll be a time where you don't even have to be at them to do it.
Yes.
They just carry on.
And the earlier you start, the better.
And my mantra has always been adopt good habits and make them your master.
Exactly.
So
Well
if you
said.
adopt good habits early, you don't have to negotiate with yourself whether you should do it or not. You just get up and do it.
True.
So that is one of the things that we learn from that. Yeah, but back to the anesthesia and being put to sleep for dental thing. I can imagine how difficult it is to extract a tooth in a little child, or to do any kind of repair work on it. How do you manage it?
Where? On the chair or under general anesthesia?
On the chair.
I
So
don't know.
I'm
I'm
just
trained.
making-
I'm trained.
I'm just making
trained.
an argument for putting more patients to sleep when you're doing these things.
Oh, actually, and there are certain children. The first group would be children who are very young, and there's a lot of work to do in their mouths. So let's say we have a 4, 5, 3-year-old, 20 teeth, 20 decays, abscess.
20 decays.
Yes, abscess and fistulas everywhere. It's better to just empty the child's mouth and then just monitor them. So
You
that's
see
like.
that in St. Lucia?
Oh yes, I've done it as well, quite a bit.
Okay.
So we have that group. So very young children that it would be very difficult for them to sit in a chair. Obviously we can't do everything all at once when they're awake. So they're gonna have to go and come back, and every time that was gonna be just more traumatic, over and over. Mostly when they're so young. So that's one of the main reasons that pediatric dentistry, we do get GA privileges. The other one is children with special needs, children in the autism spectrum, mainly, where comprehension sometimes is very difficult, or just to get them to stay still and focus, or just to use the broad word cooperate is very difficult in the chair. And because at the end of the day, we are using instruments that cut, or, you know, that can be quite sharp, or things that can break, you can't be fighting with a child uncontrollably. So then we would use, in cases like that, general anesthesia to put them to sleep.
And I think also the memory of the experience the child faces when they have this procedure, they tend never to forget it.
The traumatic experience, yes,
so
it can be.
You try to minimize it by putting them to sleep, and when they wake up, everything is done. But the memory, the traumatic experience, we try as much as possible to spare the children these bad experiences, holding them down. And
Yes, because it is scary. I mean, nobody wants to be held down and then, you know, somebody's playing in your mouth. But there are times that we have to do what we have to do. Then, you know, because we do a lot of behavior management, I try to do that as much as possible before I decide, okay, let's go down the road of general anesthesia. Because one, I need to be able to defend the reason from a medical legal perspective, going down the road of general anesthesia. But besides that, as a pediatric dentist, we are trained heavily, I should say, with behavior management at every age and stage. So when you have a very young child or even a baby, there's certain techniques and stuff that we can use that will be different for an older child, you know, and as a child gets older, or depending on the child's level of comprehension, we deal with them on that level. So a lot of pediatric dentistry is a lot of psychology. It's not that we physically or technically do things differently, it's just how we do the things. So that also applies to little kids and big kids.
because the dental aspect is very relevant for me as an ENT doctor, because we put children to sleep, remove tonsils, adenoids, and sometimes they may have a loose tooth. You have to, and the parent should notify you of that.
You have another caller, by the way.
So, but that loose tooth in the course of the operation can dislodge and end up in the lungs. That's a disaster. So all that we have to be very careful of. Hello, I think we have a caller.
Hello.
Hello, good evening.
Hello.
Again.
Doc, yeah. Thanks.
Yeah, talk to me.
I'm there again. Thanks for accepting my call. You know, it's a usual custom.
Welcome.
Okay.
Right.
Dr. Liverpool, as an adult, if I extract a tooth, with what should I rinse my mouth? With salt water or sugary or sweet water?
No water. You shouldn't rinse after an extraction. Why? Because when you remove a tooth, mostly an adult tooth, any tooth, you're removing it from the bone.
Yeah.
Right? So that bone needs to heal. So a blood clot has to form within that bone, in the hole where the tooth came out. And that's how the healing process begins. If you rinse, be it salt water, sugar water, any water, or spit, or even drink through a straw, you will wash that clot away from out of that bone, and the bone will stay dry and die. Okay? And that is extremely painful. So it is always recommended. No spitting, no rinsing, no shaking water, no even drinking through a straw after an extraction.
Because I had extraction before, you see, maybe, and then after extraction, my parents give me some sweet water, sugary water. They tell me to wash away the blood.
Yes, that was quite commonly done back in the day, but it is.
So it's a wrong practice.
It is a wrong practice. The most we would recommend 24 hours the following day after the extraction, that you can soak with some warm salt water. Okay, just soak the area. I didn't say gargle, I didn't say rinse. Just put some warm salt water in your mouth and just, tilt your head over to the side and soak it. But not to gargle or rinse, because you will rinse away the clot. Even the following day, the clot can still be quite not very strong. So it is very important. So no, it's never recommended any rinsing after an extraction.
Okay, thank you very much.
Thank you, caller. Thank you. We have another caller.
Hello.
Good night.
Hello, good night.
Good night.
Thank you for
Good night,
calling.
Doc.
Good night.
Auntie, good night.
Good night.
I do appreciate all the information I'm receiving. I'm very thankful.
Thank you.
I don't have to pay to get that. Thank you very much.
Okay, thank you very much.
Yes. What I'm asking, not too long ago, or training, not too long ago, I got to know how to brush your teeth the proper way. Because I know you have to bring brush down and down, up.
Up and down,
Then the dentist told me it's in circular motion. And what is happening to my gums right now, I think it's the gums going up to the teeth. So I said, but why my teeth right now getting longer? It's age. He said, no, it's the way you brush it. It's to brush circular motion that I didn't know.
Okay.
And did he also mention the type of toothbrush that you should use?
Yes, no, I like using the hard toothbrush, so I'm at fault. You have to use a very soft one.
A soft toothbrush, exactly. So over time, brushing one with the wrong toothbrush, anything harder than soft toothbrush, so a medium and a hard toothbrush, is way too hard for your gums. Not so much just the teeth alone, but your gums. So when your gums, as you explained, the tooth started to look longer, is because the gums started to recede around the tooth. So then an area that should be covered is now exposed. And for some people, this area being exposed can lead to sensitivity.
You said for some people? Some
people they just talk.
Right now I have to be using Sensodyne because my teeth is so
sensitive. Okay. Yeah.
I mean, if I say for some people, because it varies. But for some people, just talking and the air going into their mouths causes sensitivity. For others, if they drink anything hot or too cold, can lead to sensitivity. And again, this is also self-inflicted. It's just by brushing, you scrub our teeth. And then if we're using bristles that are medium or hard, and we have that constant 2-3 times a day, eventually the gums run away, the way I like to describe it. They run away from this harsh brushing. So they start to recede. Hence the tooth looks longer.
So why do they manufacture those hard?
I don't know. I've been asking that since I was...
I do appreciate the effort. Thanks very much.
You're so welcome.
Okay, thank you. Thanks for calling.
I've been asking that since I was at dental school. Even asked when I went to do my master's. I don't know. I think people think the harder the better.
Yeah, you know, just like when you're brushing.
I'm talking about the manufacturers.
Scrubbing.
Yes, I know. I don't know.
Oh well, the manufacturers. Why you think they do Q-tips something? They tell you, and cigarette. They say the cigarette is dangerous for your health. You still smoke it.
Right.
Because they know whatever they do, you'll still use it.
I don't know. Honestly, I've asked that question genuinely. Why would they manufacture it? I don't know.
Yeah.
They would say, people say for braces. Not really.
Yeah, we again as kids we didn't know why. You just buy a brush and that's it.
All most toothbrushes have a medium, a hard, or a soft.
That's right.
Or at least the letters written.
So your recommendation is a soft toothbrush.
Always.
You have another call?
Okay. The hard one and the medium is not.
Or they would call it firm. No firm. Always soft.
Hello, I think we have a caller. Hello, good evening.
Good night.
Good night.
Hi.
Good night.
Hello.
I have a question for the dentist.
Okay, go ahead.
In 2019, I extracted, I got a partial denture. It's two teeth, a partial denture. But that's since in 2019. And then I want to ask the dentist, is it because I am not wearing it? It hurts every time I put it. I'm in a lot of pain. The gum hurts. and there's this piece of gum that hangs out, which I extracted last year, and the doctor said there's no bits of teeth or anything in there, but I don't know why it hurts so bad, especially when I wear the partial dentures. So I want to ask if it's because I'm not wearing it often, or
highly likely that's the reason. You had it made in 2019. So, as you know, you would have had a copy of your mouth done, and they would have sent that to lab, and they would have manufactured a denture according to those dimensions, right? Now, if you're not wearing your dentures daily, for whatever reason, like Dr. Suraj was saying earlier, your teeth will migrate. There will be movement. And then you go and put the denture in again, and then it becomes tighter.
No, I think I don't know, but they fit fine. They look in. You don't even know if I have it when I have it on. But I think is, as you said, it's because I only wear it when I go out. It's just
no, ma'am. You can't do it because your teeth are going to migrate. If they are uncomfortable, what is always recommended? Go back to the dentist. And sometimes they can either smooth something out or just make it more comfortable for you. It's like buying a shoe. Sometimes you have to break it in. But you can't buy a new shoe, not wear it, only
think
wear
it's
it.
because I was not wearing it. I never get used to the touch
You
or
never
the
broke
feeling of
it
it.
in.
Yes, so that is why I think every time I put it on, it hurts the gum. I say, but that's how many years ago? Why is that still so painful? When I put the tip on, even when I don't have it, like right now I'm talking to you, I kind of touching the gum and it's a little pain in there.
No, but maybe you need to go over and maybe they probably can just realign it, but maybe you might, the extreme case, you might have to do a new one, let's say, and just because of the fact that the area there will always be changes.
Well, I did it at home. It's in Lucia, but I did the X-ray right in the U.S. last year, and the doctor said there's nothing in there. The gum is fine.
Well, I think you sound like you need to go and revisit the denture itself, but you have to wear it constantly. It's like a new shoe. You have to break it in. If you don't break it in, well...
I think that's why it hurts, Doc.
Yes,
Thank you.
I do agree. You're welcome. Have a good evening.
Thank you. Good night.
Yeah.
Good night.
All right, good night. Thanks. Yeah, and X-ray may not show everything. X-ray is not this magic thing. X-ray is more for bone and soft tissue. So there could be little areas of irritation that can be the cause.
Yes, that could be even on the denture, because remember it's a hard material resting against something soft. So you definitely need to go back to the dentist for them to have a look at it.
Yep. Yeah. So that is one thing she would have to do before you go any further with this. So I think that we are getting to the end of our program. The clock is behind me, so I hardly see that clock. I wish to say at this point, is there any particular parting words you'd like to tell the general public before we sign off?
Especially in the area of prevention.
Prevention.
I know, that's what I'm thinking.
Because, as we said...
I mean, the whole, the obvious things that we've all grown up hearing. Brush your teeth at least twice a day. Take your time. Be conscious. If you have children that are younger than age 5...
Sorry to disturb you, sorry. Twice a day could be morning and afternoon?
No, twice a day should be mornings and just before you go to bed.
Okay.
Thank you, Mr.
I have to ask you one question. If you can only brush your teeth once a day, which is the best time?
I would brush it in the night.
In the night. Yeah.
Why is that?
Because to me, bacteria, the way I like to explain it to my patients, bacteria likes to party at night. We have natural bacteria in our mouths. We have a wet, warm environment, perfect for their growth. And then when you give them food, party time.
And if they
do a lot of damage.
Right. And if you drank something and didn't brush your teeth, because brushing your teeth should be the last thing you do. And if you have
flossing, I might add in there.
Yeah, flossing. And especially when the gum begin to recede, the little gap between the teeth get bigger and more things get stuck in it. More reason for the flossing.
Yes.
And secondly, when you have this sugary stuff or whatever it is in your mouth, all night, the mouth is not being used, you're not talking, you're not swallowing or anything, the bacteria have a field day in the night.
As you said, party time.
Party time, that's right.
So, you know, always use a soft toothbrush, always one with an age-appropriate head. If you have kids younger than age 5, brush for them twice a day, last thing before they go to bed.
I think a caller also said something. Let me get your take on that. Brushing in a circular motion, she said that earlier, one of the callers.
Yes, and it's a circular slow motion. This dragging back and forth like this is not good. You're supposed to go on each tooth. Half of a toothbrush should cover the gum, the other half the tooth. So right around that gum line is also an important area to brush. And you just do circular movements, almost like a vacuum cleaner, from tooth to tooth instead of going
like when you're washing your car, you know?
Yeah. Kind of thing. And then the flossing comes in because anywhere teeth touches, the bristles of a toothbrush cannot go in between the spaces. So that is where flossing comes in. And of course, you know, seeing your dentist
at least twice a year.
At least twice a year. And for young kids, they should at least, well, I can't say the pediatric dentist, at least by their first birthday.
And you know, most people will complain about the cost of the maintenance. And I agree with you, the twice a year, and right? There are costs involved.
Most insurance will cover once.
Some people don't even have insurance, so that's the reality. So in the absence of those things, lack of resources, insurance, and so on, the preventive care. Now, I can tell you something. A lot of the stuff I admitted I'm only learning now, or maybe 20 years ago, I got to know a lot of things, right? One of the most difficult for me to have changed, that's why I asked you the question a while ago, is the circular motion. Imagine your customer used to doing something a particular way for years.
But that's the thing.
For years.
We unconsciously, we do these things so absent-mindedly. So you have to think about what you're doing. Be present when you're brushing your teeth. You know? So you can get everywhere. You can get into the back, on the insides. There's a whole world in here.
Yes. And I'm happy with the point you made earlier, that there's some, because we are rushing the process, some teeth don't get attention.
Miss areas.
And you see the bacteria now would go down to the roots and everything.
It builds up, yeah.
And as it would be that if you're in the habit of doing it a certain way, you end up doing it the same way all the time. And the same tooth that got neglected will continue to get neglected.
It just gets worse over time. Yeah, and, you know, just as from a pediatric perspective, you know, I have to, you know, brush your kids' teeth. We have a habit also of associating brushing with bath time. And I find every time I mention that to parents, they were like, oh, yeah. Because the kids might bathe, let's say at 6 o'clock, brush their teeth after a long day, but they go to bed at 9 o'clock. Between 6 o'clock and 9 o'clock, they'll eat. They might have cereal, they might do this.
That's true.
And then they go to bed. But in everybody's mind, they've brushed already twice a day. But then they're going to bed with all the food in the mouth. So it's the last thing that they should do before they go to bed.
Just a quick question. What about mouthwash? How important is that?
Unless a mouthwash from a pediatric perspective, unless it is beneficial and it has fluoride, and you might want some additional mouthwash to the fluoride toothpaste, it's only recommended for kids 6 and up or a child that can spit. But mouthwashes are not the first things that we rely on. Proper brushing, flossing, that's it. And if you need to find me and answer any questions, you can find me at Sunshine Dental.
Of course.
In Radby.
All right. Well, thank you very much, Dr. Liverpool, for
You're so welcome. Thank you
giving
for
us all this information. We, on our part in the private sector, can do so much. We would like this to be complemented with maybe a more continuous kind of public education at all the facilities that government and private sector
That
run.
would be wonderful.
Okay, because as we know, education is the way forward and prevention is far, far better than cure.
Without a doubt.
Thank you very much.
And on that note, Dr. Suraj, I think we can say so publicly that Dr. Liverpool and myself have been speaking about doing some public service announcements.
Yes.
All right.
I'm
That
looking
sounds
forward
great.
to that.
Yeah.
That sounds good.
All right.
Right.
Okay, Dr.
Thank you
Suraj.
very much, sir. And listeners, next week, same time, I'll be there.
Thank you for your service, Dr. Suraj, and thank you, Dr. Liverpool, as well.
Thank you so much.
You're welcome. Okay, so this has been Doctor in the House on Rev-Up St. Lucia every Tuesday from 6 p.m. to 7 p.m. Join us again next week Tuesday for another program with the compliments of Laasalis, Ultramat, the Labry Credit Union, and Tapio Hospital.
At Tapio Hospital, we operate a 24-hour emergency service for all your urgent healthcare needs. Our qualified medical specialist will be on hand to ensure that you receive the best of care. Call us at 459-2617. Tapio Hospital, where the patient safety comes first.
At Labry Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time. A time when your plans and dreams fall into place. When what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Labry Cooperative Credit Union. We're not a bank. We're better.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramat. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today or check us out on our Facebook and Instagram page. Ultramat, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramat.
It's delicious.
Laasalis is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? Laasalis, of course. Laasalis, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
Rev-Up St. Lucia is located at Unit 4, Gablewoods Mall, Sunny Acres, Castries, St. Lucia. Tune in to us at 97.1 FM and online at revupslu.com. Call the studio at 572